My name is Oliver Losi. In my practice in Berlin and Northern Franconia, I work integratively with Chinese medicine, osteopathy and functional medicine. If you are coming to see me for the first time, it is important that you know exactly what to expect. This video is meant to give you that orientation. The first appointment is different from many conventional medical or therapy visits. It is intentionally comprehensive. We usually schedule about 90 minutes. The reason is simple. I work in a holistic way. This means I do not only look at one single symptom, but I try to understand how your complaints are embedded in your entire system and in your life context. At the beginning, we take your basic administrative details. After that, I invite you to explain in your own words why you have come. It is important for me that you can describe your situation freely, without interruption and without evaluation. After that, I ask more specific questions. These questions do not follow a rigid checklist. They are guided by your individual problem and by my clinical experience. This detailed case history is not unnecessary complexity. It is the foundation for making a precise therapeutic decision. My work is based primarily on two medical systems, Chinese medicine and osteopathy. Both are comprehensive and internally consistent medical models. In addition, I integrate conventional medical findings. I understand laboratory values, imaging, and medical reports, and I include them in my assessment. This means I do not decide on a treatment method in advance. Only during the consultation and examination does it become clear whether your focus is more in the direction of Chinese medicine, for example acupuncture or herbal therapy, or more in osteopathic manual treatment. Sometimes a session is more advisory in nature, especially when functional or systemic aspects are central. The treatment approach develops from your individual situation, not the other way around. As part of the first appointment, I usually include diagnostic elements from Chinese medicine, such as pulse and tongue diagnosis. If time and clarity allow, treatment can already begin in the first session. This may involve manual therapy, it may involve acupuncture, or another appropriate intervention. If further clarification is needed, treatment will start at the second appointment. It is important for me that you feel understood and professionally guided. You are free to ask questions at any time. You may be skeptical. You do not have to believe anything. If something is unclear, I explain it. If something is medically complex, I translate it into understandable terms. There is one point I want to be transparent about. I do not promise that every problem can be completely resolved. Medicine does not offer guarantees. What I can assure you is that by looking at your situation from multiple perspectives, we can usually find a way to improve it, whether through system relief, stabilization, or a significant increase in quality of life. In many cases, improvement also involves changes on your side. Lifestyle factors, stress patterns, or structural habits often play a role. I will guide you through that process. To prepare for your appointment, please bring any existing medical reports, lab results, or imaging findings if you have them. Plan enough time for the session. No special preparation, such as dietary restrictions, is needed. If you are unsure whether this approach is right for you, consider the following. If you want your condition to be analyzed thoroughly, if you are open to a differentiated and integrative perspective, and if you prefer an individually developed treatment strategy rather than a standardized protocol, then this framework may suit you well. If this resonates with you, you're welcome to schedule an appointment. I will take the time the case requires. You find a link to my homepage in the video description, where you can find an appointment online, or you can find a way there to write me a message.